Hello, everyone. This is Dr. Guru again, and hope you've had some time to go through the previous lecture on Cephalometrics Part I, which covered the introduction to cephalometrics and also a brief explanation on the various landmarks and the planes utilized in cephalometrics. So today we will be having a discussion or a lecture on Cephalometrics Part II of the series. So which will entail various analysis utilized in cephalometrics. For the learning outcomes of today's lecture, you should be able to define and describe the advantages and disadvantages of cephalometrics, describe the anatomical landmarks and angles used in orthodontics, and differentiate between the skeletal and dental malocclusion types. In today's lecture, we will be covering Steiner's analysis, Down's analysis, Tweed's analysis, and finally Wits appraisal. So we shall go into each of the details in the coming slides. Coming to Steiner's analysis, this was developed almost a century ago in 1930 by Cecil C. Steiner. So this analysis will help by providing maximal clinical information with the least number of measurements. It also helps in the assessment of lateral cephalogram um, by utilizing three different analyses, which are skeletal analysis, dental analysis, and soft tissue analysis. So in skeletal analysis, it's basically to relate the upper and lower jaws to the skull or the cranium and to each other. Dental analysis will entail the relationship between the upper and lower incisors to their respective jaws and to each other, whereas the soft tissue analysis will provide a means of assessing the balance and the harmony of the lower facial profile. We shall now see what are the different landmarks used in Steiner's analysis and what are the different planes used in Steiner's analysis. So the image on the left, since we've already gone through the landmarks in the previous lecture, you should be able to identify and locate the landmarks by yourself. So starting with nasion all the way up to basion. All right. So basically, there are several landmarks: nasion, ANS, point A, point B, Pogonian, Gnation, Menton, Gonian, Porion, okay, pterygomaxillary fissure, Sella, orbital, ANS, PNS, so on. So these are the basic landmarks which are not so easy to find or locate on a cephalogram, and these were the ones which were recommended by Steiner to be used as part of his analysis. So now coming to the planes, you will basically see four different planes here. One is the SN plane, that is Sella to Nasion, the palatal plane, which runs across anterior nasal spine all the way to PNS or posterior nasal spine, the occlusal plane. Okay, this is a line which is bisecting the occlusal surfaces of molars and premolars, and finally the mandibular plane, which is from gonion to a line between gnation and menton. Okay, so these are the fold planes used in Steiner's analysis, along with the other landmarks which I've just spoken about. As I mentioned earlier, Steiner's analysis has skeletal analysis, dental, and soft tissue analysis. So here we will start the discussion with skeletal analysis, which has 5 angles to be discussed. So we're going to start with SNA angle, which is the angle formed by the intersection of SN plane and a line joining nasion and point A. So the angle formed between SN plane and nasion to point A. So this angle indicates the antero-posterior positioning of the maxilla in relation to the cranial base. So why only the maxilla? Because the point of reference we're using, which is point A, lies on the maxilla. So an increased angle which is beyond 82 degrees will indicate a prognathic maxilla, whereas a decreased angle which is less than 82 degrees will indicate a retrognathic maxilla. The second angle we will be discussing is the SNB angle. So SNB angle is formed between SN plane and a line joining N and point B. So point B is located on mandible, and hence this will enable the mandible to be related to the cranial base, or else it will indicate the antero-posterior positioning of the mandible in relation to the cranial base. So this angle can be increased or beyond 80 degrees and can give you an indication of a prognathic mandible. If it is below 80 degrees, it can indicate a retrognathic mandible. The third angle we will be discussing is ANB angle. So this angle is formed by the intersection of lines joining nasion to point A and nasion to point B. So nasion to point A, now nasion to point B. So point A was the reference point on the maxilla, point B is the reference point on the mandible. So the angle formed between these 3 points will give you A and B. So it also represents the relative position of maxilla and mandible to each other. An increased A and B angle of more than 4 degrees will indicate a class 2 skeletal pattern. All right, because point B is way behind point A, whereas a decreased or negative angle indicates class 3 skeletal pattern, wherein the mandible is placed in a relatively forward position when compared to the maxilla. The fourth angle we will be discussing is the occlusal plane angle. So these are formed between the occlusal plane, as we discussed previously, and SN plane. So the occlusal plane is represented by a line passing between the overlapping cusps. I already told you this. So here, what is the clinical significance of these planes? A decreased angle, okay, will show an upward rotation of the occlusal plane anti-clockwise. That is seen in the yellow arrow, whereas an increased angle represented by a blue arrow will show a clockwise or downward rotation of occlusal plane. So the mean reading is 14. Anything beyond that, you'll have to assess whether it is an upward rotation or whether it is a downward rotation. The last angle under skeletal analysis will be the mandibular plane angle. So this is the angle formed between mandibular plane and SN plane. As you know, mandibular plane is a line connecting gonion to gnathion, whereas SN plane is a line connecting sella and nasion. So what is the clinical implication of this reading? So an increased angle will show a vertical growth pattern, or an increased angle is also known as high angle, and clinically it can also be seen as open bite, whereas a decreased angle or low angle represents horizontal growth pattern, which can be clinically seen as deep bite. Okay, we've now come to the dental analysis part of Steiner's analysis. This one will be upper incisor to NA angle and upper incisor to NA linear. So there are basically two measurements. One is the angular measurement, the other one is the linear measurement. So the angular measurement is formed by the intersection of the long axis of the upper central incisor and a line joining nasion to point A. You can see it more clearly on the image on the left. So an increased angle will show that the centrals are proclined, whereas a decreased angle will show that they are retroclined. All right, that is the angle or the angular measurement. Now coming to the linear or the linear measurement, um, This is formed between the labial surface of the upper central incisor and a line joining nasion to point A. Okay, here the reference line is nasion to point A remains the same. One is the long axis of the upper central incisor, whereas in the linear measurement, we will use the labial surface of the upper central incisor. So an increased value will again show that the tooth is protruded, whereas a decreased angle will show that the tooth is retruded. The next component under dental analysis is lower incisor to NB, which has both angular measurement and a linear measurement. How do you get the angular measurement? So this is formed between NB plane, that is nasion to point B plane, and the long axis of the lower incisor. Okay, here the points of references are NB and the long axis of the lower incisor. So if the angle is increased or more than 25 degrees, you can say that the lower incisor tooth is proclined. However, if you see a decreased angle, you can easily make out that the tooth is retroclined. The next measurement, which is lower incisor to NB, is the distance between the labial surface of the lower incisor and a line joining nasion to point B. Okay, again here an increased value of beyond 4 millimeters will reveal that the tooth is protruded, whereas a decreased angle will reveal the tooth to be retruded. The last component of dental analysis is the interincisal angle. Sorry about that. So this is basically formed between the long axis of the upper central and long axis of the lower central incisors. So you find the long axis of the upper central incisor, construct a line, then you construct a line on the lower central incisor, and you find or you measure the angle between these two lines will give you interincisal angle. So what is the clinical implication? If there is a decreased angle, okay, it indicates bimaxillary proclination of incisors. That is, both the upper centrals and the lower centrals are proclined. If the angle is increased, it means there is retroclination of upper incisors and lower incisors, or else they are positioned more straight compared to their normal positions. So that will what help you understand how the incisor teeth are located and how is their angle in relation to each other. So we've come to the last component under Steiner's analysis, which is the soft tissue analysis. It's called S-line. S-line is a line connecting the midpoint of the columella of the nose to the soft tissue pogonion. So you construct the line and you bisect the columella, and the same line touches pogonion, you have yourself S-line. So if the lips are in front of this line, then you can say that the lips are protrusive. If the lips fall behind the line, then you can deduce that the lips are retrusive in nature. We will now discuss the second analysis, which is Tweed's, which was developed by Charles Tweed in 1930. The objectives of this analysis are to determine the position the lower incisor should occupy at the end of the treatment, and also to establish the prognosis of treatment. So basically this analysis will help you to identify which position the lower incisor should take at the end of the treatment. So with Tweed's analysis, there are a few things you have to remember. There are 3 planes you'll have to remember and 3 angles you'll have to remember. Okay, so 3 planes are Frankfurt horizontal plane or FH plane, mandibular plane, and incisor plane. Okay, these are the 3 planes. So the Frankfurt horizontal plane you're already aware of, orbital to porion, and mandibular plane, gonion to gnation. Okay, and the same way a line running through the long axis of lower incisor meeting Frankfurt horizontal plane will give you incisor plane. Now the angles in consideration are Frankfurt mandibular plane angle, or known as FMA or FMPA. The next one is incisor mandibular plane angle, which is IMPA, and the other one is Frankfurt mandibular incisor angle. Okay, if you join two planes, you get an angle. So basically, you're joining three planes, so you're getting three different angles. So FMA, the mean value is around 25, and the range can be anywhere between 16 to 35. So this has a clinical implication wherein anything in the range of 16 to 28, you can say there is a good prognosis. Uh, 28 to 35, fair prognosis. At 35, you might need to do or consider doing an extraction, and beyond 35 degrees, you can say it has poor prognosis. Okay, that's the clinical implication of FMA. Whereas for incisor mandibular plane angle, the mean value is 90 degrees, which has a range of 85 to 95. And for FMIA, the mean value is 65, which has a range of 60 to 75. Here you can actually understand the objective of Tweed's analysis, that is to establish the position of the lower incisors and also to place the lower incisor in an ideal position. Okay, so why is this important? Placing the lower incisor in ideal position is important as it aids stability of the results, okay, and thereby a good prognosis for that particular individual. Also, you have to make certain provisions in the mandibular position and upper incisors position accordingly to match the position of the lower incisors, or the final position the lower incisors will occupy. So that's what Tweed's analysis reflects, and how the objectives of Tweed's analysis are met, and this is how it will guide you in understanding where and how to place the lower incisors, and what are the implications of placing this lower incisor in that particular position. So we shall now discuss the third analysis, that is Downs. So basically, Down based his findings on 20 Caucasian individuals aged 12 to 17 of both sexes, and his analysis were drawn from this particular group. So Downs analysis basically consists of 10 parameters. 5 are skeletal and 5 are dental. As you can see, the skeletal ones are facial angle, angle of convexity, AB plane, mandibular plane angle, and Y growth axis. On the other side, the 5 dental components or the parameters are the cantifocclusal plane, interincisal angle, interocclusal plane angle, incisor mandibular plane angle, upper incisor to apoponian plane. So we shall be starting with the skeletal parameters. So the first one is the facial angle. So how is a facial angle formed? It is formed by the intersection of N Pogonian plane and FH plane. It's easy. N Pogonian plane and FH plane. So the angle which is formed between these two planes will give you facial angle. So this angle gives an indication of the antero-posterior position of the mandible in relation to the cranium. As we are taking Pogonian into reference, this will give an indication of mandible and its position in relation to the cranium. This value increases in case of skeletal class 3, as the Pogonian can be placed forwards, while it decreases in class 2 as Pogonian can be placed at a retruded position or in a retruded position. The next skeletal parameter is known as angle of convexity. So here, the angle of convexity is formed between the intersection of a line from N to point A. and a line from point A to Pogonian. So first you construct a line from N to point A. Okay, that is for the maxillary part. And then you construct a line from A or point A to Pogonian. That's for the mandibular part. So the angle formed between these two intersecting lines will give you the angle of convexity. So basically it can be a positive angle or an increased angle, and it is seen as a convex profile or class 2. However, it will be negative or decreased angle, showing a concave profile as in class 3 malocclusion. All right. Now, this next skeletal component we will be discussing is the AB plane angle. Here you have to construct a line from N to Pogonian and a line joining point A and point B. Then you can measure AB plane angle. Okay, so this angle is indicative of the maxillomandibular relationship in relation to the facial plane. So as point B is placed behind point A, this measure will be usually negative unless the patient has class 3 malocclusion, wherein the angle will be positive, because in that case point B will be placed ahead of point A. Now coming to the mandibular plane angle. How is the mandibular plane angle formed? So basically here there are two planes. One is the mandibular plane and the Frankfurt horizontal plane. So the intersection between these two will give you mandibular plane angle. So what is the clinical implication of this plane? If you see an increased plane, uh, it is suggestive of a vertical growth pattern. So you might even find the patient having open bite. Whereas if you see a decreased plane, it is suggestive of a horizontal growth pattern. In these patients, you might see a deep bite. The last skeletal parameter is Y growth axis. So basically here you have to construct two lines. One is the Frankfurt horizontal plane and another line which is running from Sella to Gnathion. And then the angle between these two planes will give you Y growth axis. Okay. Basically this indicates the growth pattern of that particular individual. If the angle is increased, it indicates a vertical growth of the mandible. Okay, whereas the angle is decreased, you will be able to understand that the patient has a horizontal growth of his or her mandible. The mean reading of Y growth axis is around 59.4 degrees. Now we will be discussing the five dental parameters, and the first one is the cantive occlusal plane. This is easy to construct because you have to construct Frankfurt horizontal plane, which you already know, and you also know how to construct an occlusal plane. Okay. However, Downs constructed the occlusal plane by bisecting the occlusal surfaces of the first permanent molars and incisor overbite. So basically this angle gives us a measure of the slope of occlusal plane relative to the Frankfurt horizontal plane. So in case the person or a patient has an increased cantive occlusal plane, it means that the occlusal plane is tilted or rotated clockwise, or there is a downward rotation. If in case there is a decreased cantive occlusal plane, it indicates that the occlusal plane is tilted upwards or there is an anti-clockwise rotation to it. The next angle is interincisal angle. We have already spoken about it previously. However, this is an angle formed between the long axis of upper and lower incisors. Okay, so where can you see it decrease? In cases of bimaxillary proplanation, and the angle is decreased, as in class 2 division 1 cases. You will see an increase in bimaxillary retroclination, as in class 2 division 2 cases. Okay, the next parameter we will be discussing is the incisor to occlusal plane angle. This is again easy to construct. You construct occlusal plane and then you draw the long axis of the lower central incisor. Okay, and the angle formed between these two planes will give you incisor to occlusal plane angle. So what is the clinical implication of this? If you see an increased angle, you can say that the incisors are retroclined. Okay, whereas if you see a decreased angle, then you can imply that the patient has proclined incisors. Now coming to the incisor mandibular plane angle. So again, the construction is to have a line across the long axis of the lower incisor and to construct a mandibular plane that is gonion to gnathon. Okay, so the implication of this angle is if there is an increased angle, you can say that the lower incisors are proclined. Okay, if there is an increase in the angle, then the lower incisors are proclined. If you see a decreased angle, then you can deduce that the lower incisors are retruded or retroclined. Here you will see the upper incisor to apogonian plane and how is it constructed and what is the purpose of constructing this plane. This is a linear measurement between the incisal edge of the maxillary central incisor and a line joining point A to pogonian. So basically you construct a line from point A to pogonian and then you mark the incisal edge of the maxillary central incisor, and then you measure the distance between these two lines, and if it gives a measurement of more than 2.7 millimeters, then you can say that the upper incisors are proclined. If they give you a measurement of less than 2.5, 2.4, then you can say they are retroclined. However, the average value is usually around 2.7 millimeters. Now we will come to the last analysis, which is called Wits appraisal. Wits stands for Witwatersrand, which is a university in South Africa where this particular analysis was developed, and that's why it's named after that particular university. The purpose of Wits appraisal is to identify instances in which the A and B does not accurately reflect the extent of anterior-posterior jaw dysplasia. We will see why is this the case in the next slide. However, Wits appraisal provides a measure of the extent to which the jaws are related to each other in the anterior-posterior direction, and also Wits appraisal is a linear measurement and it's not any particular or specific analysis in itself. Here you will see how A and B angle is constructed. So, and why is A and B angle not accurate in measuring the anterior-posterior positions of maxilla and mandible in relation to the cranial base, is because the relative position of nasion can be at different positions both vertically and horizontally, and this could change the angular measurements. The length of the cranial base can also affect A and B angle, as it can change the position of nasion, and also the rotational effects of the jaws will make point A and will make point B change positions, again limiting the accuracy of A and B angle. So this is the reason we will usually perform a Wits analysis to overcome this limitation of A and B angle. So what you do here is you will construct a line or a vertical line from A to occlusal plane. Point A to occlusal plane. Basically, you just draw a line or you drop a line from point A to occlusal plane. The same way from occlusal plane to point B. And then you measure the difference between these two lines as indicated in the red line. Okay, so this distance between AO and BO is what will give you the relationship between the jaws. So, for example, in males, BO is ahead of AO by 1 millimeter, meaning they have a more protrusive mandible. Okay, that will push BO ahead of AO. However, for females on the other side, BO and AO are at the same level or at the same point, and the line coincides with each other. Okay, if you want to see the clinical implications of this, in a patient with class 2 skeletal pattern, you will see that AO is ahead of BO because there is maxillary protrusion. Whereas for a class 3 skeletal pattern, you will see BO being ahead of AO because there is mandibular prognathism seen in class 3 patients. All right, hope this is clear. Anyway, we're going to have a more detailed discussion when we meet face to face, having a cephalogram at our disposal. So for the time being, you have to understand how to construct AO and BO, and what is the implication, where is AO and I mean, how is AO and BO related to each other, and what happens if AO is ahead of BO and AO is behind, or BO is ahead of AO. So these are the points you basically have to remember for you to make any sense of a patient's clinical status, okay, or skeletal situation. So with that, we've come to the end of today's presentation. So basically today we've learned about Stainer's analysis, which has 5 skeletal parameters, 3 dental parameters, and 1 soft tissue parameter. Then we learned a bit about Downs analysis, wherein we read about 5 skeletal parameters and 5 dental parameters. Then it was about Tweeds, wherein we understood 3 planes and 3 angles. And finally, we finished with Wits appraisal, wherein you learnt about A and B angle and why not to use A and B angle, and how to measure AO and BO, and what are the clinical implications of AO and BO. All right, so this will be the last lecture in the cephalometric series. Hope it has made enough sense to you from the point of landmarks, planes, angles, and analysis. So, however, we're going to have a, a hands-on exercise when you do the cephalometric tracing. Then we will be able to discuss maybe a little more in detail on all these different analysis. Um, so, all right, let's wind up today's discussion and lecture. Um, Enjoy your stay at home, and good luck with your studies. All right, see you.